Hello, my name is Maria Harris, and today I will demonstrate the performing a complete bath to a patient, and I will check the doctor's orders to see what will be his instructions. And after I will check the doctor orders, I will prepare all my materials which I need for the complete bath. And I have the basin here. Of course, avoid the holes, don't have a nice one. Have the gloves, have the lotion, have the deodorant, have the soap as well, and of course have plenty of towels and bath towels and towels for the patient, and washcloths. And what I will do, I will enter the patient room and I will provide privacy. And I introduce myself. My name is Maria Harris and I will be your nurse. And may I check your wristband, please? Oh, okay. And may I have your name and date of birth? Honey Bunny, 1953, November 22. Okay, great. Do you have any allergies to soap or any allergy to lotions? No. Okay. Well, the doctor recommended me to do complete bath today. And are you okay with? Um, Yes, okay. Well, I need to assess the patient to see the level of conscience, if the patient can move, if the patient does not have nausea or vomiting, if he's okay to receive a bath, a complete bath. And after I assess all this, then I will start and bring the water, and I will put the warm water, and I will let the patient try to see if it's okay with the water. And he told me that he's okay with the warm water, everything is nice. And I will wash my hands again, and I will put clean gloves. Okay, and I have a bath towel beside the with my materials, and this is a bath towel. And what I will do, I will put it lengthwise and on top of the patient, and tell the patient to hold the bath towel with the fingers, with the hands. Okay, and he holds it, and as he holds it, I will remove the blanket and the sheet. Okay, and he's holding it, and as I remove the sheets and the blankets, I have to be very careful to roll them up nicely. Roll them nicely. Don't touch my gown and my uniform, and put it in the dirty linen basket. And I'll put it. Okay, and now the patient is like that. And I will start with the face, with the eyes, and I will have a towel under the head of the patient and lift it up. And by the way, I have to be sure, before even I continue with the face, that the bed, it's at the level where it's comfortable for me, and I will not put a strain on my back. I have to be sure that the patient is closer to my side, and I'll tell him to help me to put him closer to my side, and be in a comfortable supine position, and put the side rail of the bed down, in order to be easier for me to take care of the patient. And I have to remove the gown, and if it's snapping here on top, I should start with the unaffected arm first and remove the gown, and then on the side, if I have an IV or a injury to the arm, to be very, very careful. If it's an IV catheter and the solution is going on, I have to to stop the perfusion and take the bag, and put it through uh, the arm of the gown, and then hang it back. Be sure that I will turn on the IV solution, and that everything is going properly. if I don't have a snap gown. And I remove the gown and fold it nicely and put it in the linen basket. And now I will put a towel under his head and a towel over his chest. And I need to ask the patient before I continue it if he needs to go to void or to go to the bathroom. And I forgot to ask him earlier. And of course, I have to ask him if he has any contact lens, because if I wash the eyes, to be sure that I will not remove them, okay, or remove the glasses as well. And I have a washcloth, and I will dip it in water and be sure that I wring it very, very, very well, okay. And then I will put it around my hand, one of the hands, like this, and put it around, and then bring this side of the washcloth, and I can even put it inside here to be more firm. And I'll take soap, I'll put soap, and I can ask the patient if you like soap on his face or not, or if he's allergic to any soap, or maybe he has his own soap, and use what the patient will like. And what I will do, I will clean his eyes from inside outside, okay, and do the eyes first nicely with and then change the washcloth for the other side of the eye, and clean the other side, the other eye, carefully. And then with a towel which is on the chest, that I will wipe the eyes carefully. Okay, and now I will dip it in the water, rinse it, and wring it very well. And now I will wipe again to remove and change. And now I will dry it carefully. Okay, and now I will wash the washcloth. I'll do the same and put it around my hand, and put the soap and wash his face, cheeks, forehead, cheeks, the ears, on the neck, the back of the neck, and wash everything. And then rinse it again, well, wring it, and go again over the forehead, cheeks, nose, chin, the neck area, and then be sure that I will dry the patient carefully over all the areas. Okay. And now what I have to do is to start with one of the extremities, and with the extremity closer to me. And I will take it, bring the arm above the blanket, the bath blanket, and I'll take another towel and I'll put it lengthwise under the arm, very nice, tucked in, okay. And then I'll take, and are you okay? Are you comfortable? Good. And I'll take the washcloth, wring it very well, put it around my hand, and put the soap. I have the soap here, and do it from the wrist up to the shoulder, and clean it like this, slowly and nicely, okay. And clean it, and then I will rinse it, wring it very well, put it again around my hand, and now I will rinse the arm, the arm and the shoulder very well. Good. If the patient would like to soak his fingernails in water, I will bring the basin with the water close to the bed, and put the hand for 2-3 minutes in the warm water. And after it's done, I can take the washcloth again and wring it very well, and then be sure that I will wash it between uh, the fingers and wipe it properly, and then with a towel, which I have it here, be sure that I will dry everything properly and cover it with a blanket, the bath blanket, because we don't want the patient to be cold during these procedures. Okay, now we can, and this is dirty towel, I'll put it in the linen. And of course, we have to be very careful if the patient wants us to cut his fingernails, that will follow the policy. We file the fingernails, or we follow the policy of the hospital or the institution as well. After I finish this arm, I will go on the other side of the bed and do the other arm. And I will repeat the procedure, okay? The same procedure as I did to this arm. And now we'll do the chest. And what I will do, I will put a towel, a clean towel. I'll take this away and put it out, and then I'll put a clean towel, and very slowly I will drop the blanket, the bath blanket, down until to the waist, okay, and maybe like that, and the towel should be lengthwise, okay. And what I will do, I will take the washcloth, okay, and if the water got cool and the patient would like to have warm water, I can go and change the water, but I have to be very sure that I will put the rails back and that the patient is covered and is not cold, okay. But still the water is warm. I will wring it, and I will put it around my hand, and okay. And what I will do, I will lift up the towel, and I will back and forth, I will go and rinse his chest, okay. And then I will dry the chest properly, nicely. And now I will, of course, if I use soap, I should use the soap first, and then rinse the washcloth and rinse the patient. And after I will rinse it, I should dry the patient. That should be repeated every time. Put the soap, rinse the soap, and then dry the patient. And I will wash the washcloth, wring it very well. I will put it around my hand and put the soap, and I will clean the abdomen very well, okay. And I need to be carefully around the folds to be sure that they are clean, around the umbilical to be sure that it's clean. Then I will rinse the washcloth, and then I will rinse the skin from the soap, and then I will dry it, okay. And I forgot something. When I wash the hands, I have to bring the hands up above the head in order for me to clean the axilla, and clean it from the wrist down towards the axilla in a few strokes, and wash it and then rinse it. And then if the patient would like to put some deodorant, I will put deodorant over the axilla, okay. And if the patient will like to put lotion on the arms, on the hands, I can put the lotion as well. Okay, after I finish with the abdomen, I will dry the patient, and then I will make sure that I will put the bath towel back and remove this wet towel away from the patient and put it in the trash, in the linen basket. And be sure that the patient stays warm all the time. And now I have to clean the leg area, okay. And what I will do, I will take the blanket, the bath blanket, in the midline of the body, and expose the leg. And then I will have another towel which I'll put it lengthwise and put it under the leg, very nice. Be sure not to expose the private area, and be sure that the patient is comfortable. And what I will do, I will wring the washcloth, and I will wring it very well. I put it around my hand, puts the soap, and first from the ankle to the knee, wash it very nice. And as I wash the patient, I should evaluate if he has any edema, skin break, lesions or ulcers or whatever. I should assess all the time the patient as I do the bath. And as I continue it, then I will rinse it, wring it very well, and rinse the skin, and then I will repeat the same motion from the ankle, from the knee up to the thigh, wash with a soap, then rinse it, and then dry it very careful. Now, if the patient would like to soak his feet in the water, I can bring the basin to the bed and let him soak his feet, and be sure that I clean very well between the toes and dry very well between the toes as well. And I can apply lotion on the patient, okay? And then after I finish with the leg, be sure that it's dry. Remove the dirty towel, okay? And cover the patient. And of course, I will move on the other side of the bed. Now, during this procedure, be sure that you put the rail up, rail down, to make you more comfortable, but in the same time to have the safety of the patient. After I finish the other extremity, I will ask the patient help to move it on one side, okay? But be sure that the rails are up when the patient are, in order for the patient not to fall from the bed, in order for me to clean the back of the patient. And as the patient rolls over, be sure that you protect all the private areas and the patient is good, okay? And what I will do, I will wring the towel, I will put it around my hand and put the soap, and have a towel on this side, okay? Remove the bath towel, and be sure that you provide privacy to the patient, and from the neck until to the waist. Now, if you see any fecal matter on the patient or on the sheet, be sure that you have the wipes available to wipe, or the toilet tissues, and wipe well the feces away in order for you not to. And if you deal with the feces, be sure that you clean, remove the gloves, change the gloves, wash your hands, and put clean gloves, okay? And during this process, you can change the water a few times to be sure that the water is warm as well. Then from the neck to the waist, I will clean the back of the patient. I will rinse it, rinse the washcloth, rinse the patient's skin, and then be sure that I dry it as well properly. And then I will do the private area, and this should be from the front to back. And I will use the washcloth, clean from the front, first on the buttocks, and then in the anus area, that I clean it properly, and be sure that I dry it properly. And then I can do a back massage for the patient if the patient will like, or apply lotion if the patient would like, and be sure that it's dry. And now I can the pad of, under the patient, if it's wet, be sure that I will bring it to until under the patient for me to be able to remove it as I move the patient back on the supine position. And I'll move the patient back, okay? Okay, and of course I should provide, if the patient will like, um, the private area to be cleansed, be baited. Be sure that I know how to clean the female private area, the pericare, or for the male as well. And that will be the last part of the patient care too. And then if we have a person which is unconscious, when we when we wipe the eyes, we have to be very careful when we wipe, and we have to be very careful that we'll put the patch in order the eyelid to be closed, not to leave it open. Then, and the the patch to be very gentle put over the eyes of the patient. That we need to be very careful. Okay, now uh, um, we have the best ways to change the to put the gown to the patient, a clean gown, and to change the linens as well, to put clean sheets, clean under a pad as well, clean blanket for the patient, and be sure that we assess that all the catheters are in the correct position, they function, the IV is in correct position and it's functioning. Be sure that everything which we touch around the patient, that everything is it's properly function, and we put the patient in the comfortable position. If the patient would like to be up or down, be sure that whatever the patient it's comfortable, they will place him. And then we have to be careful that we'll put the call, um, uh, the bed call closer to him in order to be able to call us if he needs anything else. Be sure they will put the toiletries close to him, the water, the bed table close to him, and be sure that we ask him, do you need anything else? If everything is fine, I will remove the gloves, remove all the bed linens, remove put the soap where it belongs, take the basin, clean the basin, put all the dirty laundry in the basket, and be sure that I will wash my hands as well, and be sure that document the response of the patient, how the patient was during the bath time, what was his how much he could help me, how much he enjoyed, and if I had any problems or any accidents during the bath, that I will document everything. And uh, and that's it. I hope that everything is nice.